Hello and welcome. I'm Michelle Fox with IndustryIQ.com. This week we'll be talking about digital imaging with Dr. Michael Wing, who recently spoke with us at the International Congress on 3D Digital Imaging. We'll also catch up with Dianne Glasscoe Watterson, the columnist for RDH and Dental Economics magazine. And we'll also speak to Dr. Joe Blaes, who offers us a preview of the December issue of Dental Economics. Dr. Michael Wing has a dental practice in Eagle, Colorado, and he speaks on the topic of cone beam and CAD/CAM for general dentists. We recently had a chance to catch up with him at the 5th International Congress on 3D Digital Imaging in Grapevine, Texas, presented by ICAT, Gendex, and Henry Schein. At the meeting, Dentistry IQ asked him his thoughts about what general dentists could learn from his digital experiences.
I think just the ease of use of this technology and integration into the practice is an important concept. People have been talking about guided surgery for a period of time, but it's never really been easy to implement. And I found that with the use of the software that's available today that I acquired from Imaging Sciences and from the software that I'm acquiring from E4D, that this application could be implemented quite easily into the practice. I find the accuracy of implant placement to be phenomenal, and I find that the use of CAD/CAM dentistry to restore those implants just makes my life easier, a stress-free environment, and I'm able to communicate that better to my patients, and I'm able to get a better success rate in my practice outcome with using those technologies.
Dianne Glasscoe Watterson, the author of Staff RX column in RDH, recently wrote about a successful dental practice that wanted to reduce the amount of appointment time for dental hygienists in the practice.
But this one was very unique in that while in a time where so many hygienists are struggling to stay busy, and in fact, many hygienists are getting their hours cut because they can't keep the schedule full and all those kinds of things, in this situation, this hygienist was seeing a time where they had more demand for hygiene services than they could fulfill, and the schedule was slammed with patients. So the doctor was determined, he had looked at different options, how they could remedy this situation, and so the doctor had decided, well, the best thing to do would be to shorten the amount of time they were giving, particularly for the 3-month maintenance patients, in order to make more appointment time in the schedule. Well, she was very upset about that because they provide a very high level of care.
Her response to December column in RDH is that the practice should not be reducing services that patients value, but to find other ways to increase the hygienist's capacity to deliver those services.
So if you start cutting back the amount of service that you give to those patients and you're reducing your quality, I would just ask the doctor, I'd say, well, if, I use my whole amount of time for the patient, what do you want me to cut out? What is it you would have me to cut back on? Would it be scaling? Would it be home care instructions, perio charting? Just what would you have me to cut? Because our patients understand the value that they're getting for the time. As a consultant, I would say what this doctor needs to do is increase his capacity, not reduce the appointment times they're allowing, but figure out a way to allow for more hygiene time. In other words, go to an assisted hygiene model, or instead of closing at 5, staying up until 7 a couple nights a week, or maybe opening up some more time, some time in the week that's not currently seeing hygiene patients. Increase the capacity rather than reduce the quality of care that they're providing to the patient. That would be my solution for this very good problem that they're having in their practice.
We love our Dianne. And within the last couple of weeks, Dianne has just published a book in my hand. We're delighted for her, and here she talks about what prompted her to write it.
Well, this book has been in my mind and in my heart for a long time, and so I finally just decided the only way it was ever going to come to pass would be to hire somebody to help me put it together. And so I hired Ted Annaball, which is a good friend of yours. He used to work for Penwell, and Ted actually helped to edit some of the columns as they went to print in the magazine, and so I contacted Ted. I said, I want to just send you everything I've done for the last 5 years, columns and features and everything, and see if you can pull something together in some kind of cohesive format. He said, great, send it to me. So I sent it all to him. Ted did the original formatting, and he just did a beautiful job.
You can obtain details about ordering the book at www.professionaldentalmgmt.com. And finally, the December issue of Dental Economics will soon be in the mailboxes of dental practices throughout the country. Dr. Joe Blaes recently highlighted 4 articles of interest to DE readers. Dr. Blaes, what should we be looking for in the December issue?
Hi, I'm Dr. Joe Blaes, editor of Dental Economics magazine. I'd like to tell you a little bit about our December issue because we're really excited about bringing it to you. First of all, I'd like to talk to you about Dr. Gordon Christensen's article in this issue. It's an excellent article, and what he's done is on the more ceramic-based type of crowns, and he's wondering if maybe we're seeing the end of the traditional porcelain fused to metal crown because now there are so many more aesthetic and stronger even ways of doing crowns, both in the posterior and the anterior. In fact, he goes so far to say that in the future that he sees, that he believes that the ceramic based, like zirconia based, and these disilicate crowns and the all porcelain crowns will eventually replace the standard porcelain fused to metal crown in the future. In his implant retained removable prosthesis article, Are You Losing Money?, Dr. Paul Child writes about overdentures, both from the standpoint of partial and full dentures and how to stable them with implants. Dr. Child, by the way, is a prosthodontist and a certified dental technician, so he brings a wealth of knowledge to this type of situation. He provides you with an easy to understand step-by-step procedure that you can bring this into your practice and bring this to your patients as a real service. I have once again picked the best pearls of 2011. And this is no easy task because I feel like every pearl that I have written is the best. And pearls are defined as a material or a device that you can use in your clinical practice to make the practice easier, faster, better, maybe a little bit less expensive, and certainly more fun. In December, you'll find all 21 of the best pearls that I've picked for 2011. And I know you'll think too that they're all winners. Be sure to see the tax calendar for 2012 in this issue, which has been compiled by John McGill, who writes the McGill Financial Advisory newsletter and is a principal in the McGill and Hill group. This calendar will keep your tax reporting days straight for you so that you won't be late and you won't have any costly interest or late filing fees assessed against you. Most dentists will tear these pages out of the magazine and keep them for future reference.
Thank you, Dr. Blaes, for that. And thank you for joining us on DentistryIQ.com. I'm Michelle Fox, saying goodbye until next week.